Speaker, Gloria moved to London West in 2021 and has an autoimmune disease. For the last 3 years, she has been registered with Healthcare Connect, all while desperately searching for a doctor to help her manage her condition. She told me, quote, "It shocks everyone I know when I tell them I don't have a doctor." Speaker, what advice does the Premier have for the more than 65,000 Londoners like Gloria who feel hopeless about ever being able to access primary care?
Minister of Health.
Thank you, Speaker. You know, Gloria's story is frankly the exact reason why we have seen what happens when you don't ensure that you have sufficient health human resources. When you cut seats in medical schools, whether it was 10% under Bob Rae's government or 50 medical seats under the previous Liberal government. That's what happens. You have a constricted supply, and we're changing that. We are rebuilding the system to make sure that for decades to come, we have sufficient individuals who we know want to practice in the healthcare field in the province of Ontario. And now we're expanding with medical schools in Brampton and in Scarborough. You know, Speaker, in September of 2025, we will have medical students starting to train in Brampton for the first time in the province of Ontario.
And the supplementary question, back to the member for London West.
Thank you very much, Speaker. This government has had 5 years to fix this problem. They knew the crisis was coming, and the crisis is here. Speaker, Susan also has a rare autoimmune disease. She lives in London West, and she was informed 3 months ago that her family doctor was closing his practice at the end of March. Without another doctor to take over, he advised his patients to contact Healthcare Connect. When Susan called to register, she was told she must first de-roster with her current doctor, even though he was still practicing for 3 months, forcing Susan to leave her doctor early, then go potentially years without another doctor, has Susan feeling angry, helpless, and very, very worried about her health. Speaker, what advice does the Premier have for Londoners like Susan?
Minister of Health.
I will say once again that will the member opposite let the constituent know that the Thames Valley Family Health Team is expanding in both London and Woodstock? Will the member opposite share with her constituents that these 78 expansions are occurring across Ontario, including in the London region and in London, the city of? So we will make those investments, and I hope the member opposite is not only sharing those expansions with her constituents, who clearly want to be connected with the primary care multidisciplinary team, but also support these in a vote in the chamber so that she can show her constituents that she is also on board and on side to expand primary care in the province of Ontario. Thank you, Speaker.